Should you go in to see your doctor during this coronavirus pandemic? Let's say you need your diabetic medications refilled, or maybe you need your blood pressure medicines refilled, or maybe you need a routine physical or a pap smear or something else. Nothing big, but you need a routine follow-up. Should you go into your doctor's office? Well, I'm going to tell you what I've been doing with my practice. Of course, every part of the country is very different. And first thing I want to say is you should take your doctor's advice, okay? Make sure that you're calling your doctor to find out what they recommend for you. But I wanted to tell you what I'm recommending to my patients and what's happening in my neck of the woods. By the way, I live in Philadelphia and I practice in South Jersey. So you guys know we have a lot of cases on the East Coast in this sort of area. And my office, I'm a family physician, is currently closed right now. But I am able to see patients through telemedicine or telehealth using my laptop and my phone, okay? So when people ask me if my patients are saying, hey, should I come in and see you? My answer is no, I don't want you to come in to see me anywhere. I don't want you to go to a doctor's office, but I still do want you to be seen. And we can do that by telemedicine, just not with you coming into my office and sitting in the waiting room. We don't want patients to be put at undue risk for coronavirus, okay? So the point being here is that you should call your doctor if you need routine refills or things like this. Call your doctor's office to find out what they're doing, to find out what the policies and the procedures are and how your office is handling coronavirus. The idea is you want to be as safe as possible. And what I would say is for things that are not urgent or not an emergency, you should err on the side of caution. And I think your doctor probably would agree as well. Now, there's something I do want to say though, and that is for things that are urgent or emergent, okay? That means things like chest pains, shortness of breath. You feel like you might be having a stroke. Something is really wrong and you don't know what's wrong with you. Remember, emergency rooms are there for a reason. They're there for emergencies. So please do not let the pandemic stop you from getting appropriate care if it's urgent or emergent. That is super important. And we also have to remember that, yes, many of my patients, I can say, okay, you know what? I'll do a telehealth visit from my living room, not my office. That's where I am. But there are some patients who do need to go in to be seen. Patients who are pregnant, your OBGYN might need to see you. For patients who are on chemotherapy, maybe patients who are on dialysis and things like that. So understanding and being able to have that communication with your doctor about what precautions you should take and what you need to be doing with your personal situation is going to be of utmost importance. As you guys see, coronavirus is still here. We are flattening the curve, which is so exciting. And I'm so proud of all of us because that means we're social distancing and we're doing all the stuff that we need to be doing. But we also know we have a long way to go. Make sure you're calling your doctor and figuring out what you should be doing and try your best to minimize your risk of getting coronavirus. We definitely want to do that. Guys, I'm Dr. Jen Caudle. Thank you so much for joining me. Make sure you stay healthy and I'll see you tomorrow.